Hello all, I am Dr. Shilpi Reddy from KIMS Cuddles Kondapur. It's a mother and child center and I am the head of the department here. Today we are going to talk about urinary tract infections. First, to know the symptoms about urinary tract infection, you have to know what is urinary tract infection. The female urinary tract consists of the urethra, the bladder, two ureters, one on each side, and both the kidneys. Now, when it comes to female urethra, there are specifically, it is very unique, like it is a very short urethra. So, unlike the male urethra, the female urethra is shorter, and under the influence of pregnancy and pregnancy hormones, the chances of urinary tract infections also increase because mostly they are ascending infections. That means the infection from outside goes into the urinary bladder through the urethra by the way it ascends in the form of an ascending infection. So, what is urinary tract infection? So, if you have to talk about urinary tract infection, any infection that is caused by a bacteria or fungal or any organism that is from outside and is harmful, which goes through the urethra into the bladder or into the ureters or into the kidney, can cause urinary tract infection. What happens is when the bacteria goes from the exterior to the inside, they colonize inside the bladder, and from there they can ascend through the ureters into the kidney also. So, wherever they colonize and grow, that leads to infection. And when infection comes in, you have symptoms and signs of infection. When you have to talk about risk factors for urinary tract infections, a low immunity level, it can be low vitamin D level also, a low intake of water and decreased personal hygiene, using multiple toilets which are not with good hygiene, and storing of urine, holding of urine for a very long time is also one of the risk factor. So generally people think that you can hold urine. Once they go out of the house, they come back to the house and go to the washroom. That is absolutely not correct, and it is one of the predisposing factors. And decreased amount of water intake also gives rise to concentration of urine. And the more you void and the more amount of water you take, the less likely for the bacteria to colonize. And when you have high sugars or any immune deficiencies or any susceptibility to infections, generally also you would have a risk of urinary tract infection. So it is about your immunity levels, it is about your health pattern, it is about how careful you are, it is how your water intake is there, and it is how you keep your cleanliness and regular voiding of urine. Other than these also, in pregnant women, because of the action of the progesterone hormones and the pregnancy hormones, there is more relaxation of the urethra and ascending infections are more common. And also in the perimenopausal age group, wherein postmenopause and perimenopause, when the estrogen levels are going down, there is so much of dryness and there is so much of changes of lesser estrogen level, dryness, itching, and recurrent fungal infections in the vagina and bacterial infections in the vagina can also give rise to a concomitant urinary infection there. So precisely if you treat urinary infection at that point of time and do not take care about the hormonal effect of the estrogen over the urethra and the periurethral area, then the chances of recurrent urinary tract infections will be there. Urinary tract infections can be diagnosed very easily because when you have to diagnose urinary tract infection, you have to give your urine for examination. So, urinary examination has two different aspects. One is the complete urinary examination and the second one is the urine culture and sensitivity. Usually I suggest urine culture and sensitivity because it not only identifies the infection, it identifies the organism that causes infection, and it also gives the information about which antibiotic can be given if there is any infection, to specifically which antibiotic will work for that bacteria also it gives. So when people are having urinary symptoms like painful urination or pain abdomen, or whenever they're passing urine it is causing a lot of pain, or after passing urine it is causing a lot of pain and flank pain, or they have history of renal calculi, and they have history of fever, they have history of chills, or any of these symptoms that depict urinary infection, you have to ask them to give the urine sample. Preferably urine sample, if it is given early in the morning, the first void urinary sample, it will be more specific in giving the culture report or the examination report. And once when you try to collect the urine, you should always take the midstream urine. So first urine should be passed, and midstream urine is specifically going to give you the correct report. And urine examination report comes in say about 2 to 3 hours depending on the lab, but urine culture report takes about 48 hours to come. But that is more specific in terms of diagnosing which bacteria and which antibiotic works very well in this scenario. And not only the amount of the antibiotic that can be given according to the weight of the patient, number of days is also very good. It also prevents in recurrence, because we specifically treat the organism, and that is what is very important to prevent recurrence. And you just can't give any antibiotic over the counter antibiotics or anything non-specific, not non-community based antibiotics randomly, because that is increasing the chances of resistant organisms. So it is important that a culture is taken so that we have specific treatment. And some people do have vaginal infection also, and white discharges and yellow or greenish color white discharge. A concomitant vaginal swab also will definitely benefit in treating both the infections together. So it is important that if you have concomitant infection, yes, you have to definitely treat it. And when people come for urinary infection, anyways, if they are sexually active, you gently can do a vaginal examination to locate any source of a concomitant infection. And if everything is normal, you can even counsel them at that point of time for a pap smear if they can, because usually people don't volunteer themselves for pap smears generally, and they don't come annually for a checkup. So if they have any issues, a concomitant pap smear also can be done. If you have to talk about treatment options, as I have told you, there are two different lines of thoughts. There are general practitioners who give community specific antibiotics which generally work for urine infections depending on the community area and the area that is specifically what cultures we get in the general population, and depending on that they give an antibiotic that is non-culture antibiotic, which is randomly given in the randomly given just like that. But as I have told you, it have to be specific in giving the antibiotic, and a culture sensitivity test is definitely going to help you. But every place you don't have the culture sensitivity test that is available. So even in such situations, a small urine examination can diagnose some kind of what kind of a bacteremia, that either whether the bacteria is there, whether the number of pus cells are there or not. So always for urine infection, the treatment aspect is not only medication, you have to counsel them about the water intake, regular voiding of urine, and the diet that they have to take, and how to improve their immunity levels and prevent infections in future. So you have symptomatic medication and you have specific medication. Symptomatic medications for fever, you have to give them paracetamol, and if there is any pain, you can give them bladder analgesics, and if they have any voiding difficulty, you can give them any analgesic that is specific for the voiding pain relief. So these are certain non-specific treatments. Some specific treatments like antibiotics have to be judiciously given, and they are really important in giving the best treatment possible. Specifically, if you can get a culture done, it is very good. Indeed, it also prevents future infections. And the treatment does not stop here. You have to generally counsel them about their general health, general cleanliness, improving the sanitization techniques, and the regular toilet care. Not only this, menstrual hygiene also has to be explained and reinforced very well. You can give them vitamin D supplements, and there is a role of cranberry extract and all. There are some additional measures that you can give them if they have any recurrent infection chances. And not only this, the amount of water that they have to take and regular voiding of urine has to be explained and reinforced. And as I have told you, if there is any estrogen atrophy or it is perimenopausal and postmenopausal causes, you have to concomitantly look into the hormonal replacement aspect or a local cream that will regenerate and give that relief from dryness. Not only this, you have to concomitantly look into the vaginal aspect and the vaginal infections or any candidal infection that is constantly there and giving lot of irritation and itching. So all these things have a role when you do it collectively. So it's always a 360-degree role, 360-degree correction of problem. It is not only about treatment of an antibiotic that results in decreasing the urine infection. It is our duty to definitely give a specific role in quality of life that they have to correct to give relief from future infections. As I have told you about the precautions, definitely hygiene plays a very important role. Water intakes plays a very important role. Not only these two, regular voiding of urine and cleanliness and hygiene, that is very important. And hormone replacement therapy, if needed, definitely has to look into, because it is one of the reason why recurrent urine infections are seen in women, especially postmenopausal. And in pregnancy, it is really important that you do regular screening. Especially I myself do for all my pregnant women a regular urine culture screening, because urine infections are one of the predisposing factors and predictors for preterm delivery. So definitely you have to watch for urine infections, and subclinical urine infections are very notorious in such way. So I usually do first trimester and second trimester proper screening for urine cultures, so that I don't land any of my patients into trouble with preterm deliveries. And subclinical urine infections are very common in pregnant women. You have to watch them out. And especially in summers, now that summers are approaching, it is very important to take good amount of water and regular voiding of urine. Your thirst is an indicator. Do not neglect your thirst, because the more thirsty you are, the requirement of water is more. And every toxin in your body goes through the kidneys and it gets washed out through the urine. So it is important that we flush out the toxins and do not concentrate them in the bladder. And very importantly, small urine infections in future, if you neglect them, they can ascend and damage the kidney and cause pyelonephritis and kidney damage eventually. So it is important that small renal calculi, which can cause recurrent infections and recurrent urinary tract infections, should be taken care to prevent any kind of bladder and kidney damage in future. Thank you.